go. It's a disaster. It's been a week, folks. So before we find out if people like health care reform, we should wait to see what happens when we actually put it into place. Just a thought. Now, look, this reform is not going to solve every problem with our health care system. It is a huge, complicated piece of business. A couple of $1 trillion. Thousands of people affected, thousands of people working in the industry. It's not going to bring down the cost of health care overnight. We're going to have to make some adjustments along the way. But it represents enormous progress. It enshrines the principle that every American should have the security of decent care, and that nobody should go bankrupt because they've got a kid who's sick with a pre-existing condition. That small businesses shouldn't be burdened because they want to do the right thing by their employee. So now that this bill is finally law, and all the folks who've been playing politics will finally have to confront the reality of what this reform is, they're also going to have to confront the reality of what it isn't. They'll have to finally acknowledge that this isn't a government takeover of our health care system. They'll see that if Americans like their doctor, they will keep their doctor. And if you like your insurance plan, you will keep it. No one will be able to take that away from you. It hasn't happened yet. It won't happen in the future. What this reform represents is basically a middle-of-the-road solution to a very serious problem. It's not single payer. Some people wanted that. I understood that, but that is not. See? So, it's not that, but it's also not what the Republicans were advocating for, which is essentially that you completely deregulate the insurance industry, you let them run wild, and that somehow you were going to benefit. That was their theory. It was called the Foxes Guarding the Chicken Coop health care plan. So, it's not the plan that some on the left supported in the past. It's not what some on the right supported, but it is a common sense plan. This reform incorporates ideas from both Democrats and Republicans, including, by the way, a number of ideas from your senator and somebody I consider a friend, Olympia Snowe, who spent many hours meeting with me on this bill. And what this reform does is it builds on the system of private health insurance that we've already got. So that if you have insurance, this reform will make it more secure and more affordable. If you can't afford insurance, or if you've been denied coverage, you're finally going to be able to get it. And over time, costs will come down for families, businesses, and the federal government, reducing our deficit by more than $1 trillion over the next 2 decades. That's what this reform will do. Now, Portland, it'll take about 4 years to implement this entire plan because we've got to do it responsibly. We need to get it right. But there's also a set of reforms that will take effect this year. So I want everybody to understand what's going to happen this year. Starting this year, millions of small business owners are going to be eligible for a tax credit that will help them cover the costs of insurance for their employees. And let me talk about what this means for a small business owner like Bill Milliken. Is that it? Bill, stand up. That's Bill right there. Now, I want to give a little plug to Bill here. Bill owns owns Market House Coffee and the Maine Beer and Beverage Corporation, both here, right here in Portland, Maine. In exchange for this publicity, I hope that I'm going to get some samples of the beer. Okay. He nodded in the affirmative. He wants to give his part-time employees health insurance, and he wants to give them more hours, but he can't do both. He can't afford to do both. So this tax credit will make it easier for an employer like Bill, who wants to do the right thing by his workers. Starting now, small business owners like Bill will have the security of knowing that they can qualify for a tax credit that covers up to 35%, over a third of what they pay for their employees' health insurance. And starting now, small business owners that provide health care for their workers can sit down at the end of the week, they can look at their expenses, and they can begin calculating how much money they're going to save. And for small business owners who don't currently provide health insurance, they're going to be able to factor in this new benefit when they're deciding to do so. Now, it won't solve all our problems, but it means that employees that work for Bill have a better chance of keeping their health care or getting health care. And if they're already getting health care, it means Bill's got some extra money. That means he might hire that extra worker. Right? So this health care tax credit is pro-jobs, it's pro-business, and it starts this year. This month we're going to be sending out details on how to apply for this credit to millions of small businesses across the country. But if you want to learn about it today, we're going to put all the facts on our website, www.whitehouse.gov. All right, so that happens this year. Here's what else happens this year. Tens of thousands of uninsured Americans with pre-existing conditions and parents whose children have a pre-existing condition will finally be able to purchase the coverage that they need. That happens this year. So, last week I met a man named David Gallagher, whose daughter Lauren had written me a letter last year. When Lauren's mom lost her job, their entire family lost their health insurance. When they tried to get new insurance, David was denied coverage because he once had a complication-free hernia surgery, but the insurance companies wanted to weed him out. They figured, well, the guy's been sick before, we don't want to have to cover him, we don't want to bear that risk. So Lauren's been worried sick about what would happen if her father became ill or injured. Now, because of this reform, David Gallagher can finally have access to health insurance again. That begins this year. That starts this year. So that's just one of the insurance reforms that starts this year. Here's what else happens. Insurance companies won't be able to drop people's coverage when they get sick, or place lifetime limits, or restrictions, annual limits on the amount of care they can receive. Now, this isn't some abstract concept. There was a story in a local paper this week about a woman named Teresa D'Andrea. And Teresa's husband, DeAndre, excuse me, thank you. Where is she? Are you up there? Stand up. Stand up, Teresa. Now, Teresa's husband passed away recently from cancer. And before he died, he hit the lifetime cap on his insurance. And as a result, Teresa's not only had to cope with the loss of her husband, but with $60,000 in medical bills. And this is after she's already spent all of her retirement savings on medical care. Now, because of this reform, a situation like Teresa's won't happen again in the United States of America. And that's going to start this year. And we're inspired by stories like yours. Starting this year, all new insurance plans will be required to offer free preventive care. And starting this year, this may interest some of you here, if you are a young person who doesn't have insurance or doesn't have a job that offers insurance, you're going to be able to stay on your parents' insurance policy until you're 26 years old, starting this year.